So, good evening, one and all present here. NSS IIT Patna is back with our third guest, Dr. Esha Chainani, for the guest lecture series. She's a gynecologist practicing in Mumbai, and she aims to break the stigma around women's health by advocating an inclusive and open practice of gynecology. Esha is the author of several internationally published research papers and health articles in the media, like Swaddle. She advocates for accessible healthcare through her Instagram account, as well as posting about reproductive health and mental health and sexual health. Dr. Esha, it is an honor having you here. Thank you so much for taking time out to be here.
Yeah, it's so good to be here. I mean, it's amazing that we're opening up conversations like this and having talks like this. So that's great.
So starting off with the questions, while most of us know the mechanism behind the menstrual cycle, for those unaware, could you please explain what a period is and why periods occur?
Yeah, sure. So basically, a period is when your endometrial lining, which is the lining of your uterus, sheds every month when there is no fertilization or basically a baby that is formed. So every month, your egg gets released and your body preps for pregnancy in that sense. Every time there is no fertilization, which means when a sperm doesn't meet the egg, the environment or the house that it's created in the uterine lining sheds off, so a fresh one can grow again the next month. So that's basically what your period is. So the blood, like there's nothing, there are a lot of these myths that period blood is dirty blood, or it's impure, and when you're bleeding you're impure, but it's honestly just normal regular blood and little bit particles of your uterine lining, which are all sterile, which are all absolutely clean, and very vital if there is a baby involved. So that's really what a period is.
Right. Thank you. That was really insightful. And while what are some of the you mentioned like there's a lot of blood that comes out along with parts of the uterine lining, right? So what are some of the
Yeah.
important hygiene tips that one should practice during menstruation?
Okay. So I think again, the blood itself
Um,
isn't
voice is
dirty. Any blood stagnant for a while, it's the best culture media for bacterial growth and viral growth and
right.
all of that. So, that's the problem when it comes to cleanliness in your periods. It's not that the blood itself is unclean and that's why you should get rid of it and things like that. But it's just that if you keep that blood there, it will kind of become this huge host for infections.
Yes.
So now so what do we do about this? One thing is, and guys, I'm giving you a disclaimer now. I'm just going to be very like blunt with things, and I feel like we
Yeah.
should all be. So so basically, cotton underwear, change your underwear like 12 hourly. If you're wearing pads, if you're wearing a tampon or even a menstrual cup,
Yeah.
keep changing it, but not like every hour or every 4 hours. At least once in 12 hours is good enough. Ideally, 8 hours is perfect. So I think those are the two things. Please, there are some of these weird myths that go around that you can't have a bath during your period, or you can't wash your hair during your period. That's really not at all in any
Your voice is
way
breaking.
related.
Can you
So
repeat your
your general cleanliness, that's about it. And wash the air, like your vagina is so yeah, that just maintain your general cleanliness and you should be fine.
right? So moving on to like you mentioned tampons and sanitary pads, right? So what is the exact like difference between a tampon and a sanitary pad and a menstrual cup?
Okay. So this is like a really good question because now everyone's talking about tampons and menstrual
Yeah.
cups and things like that. So I'm just gonna run you guys
Dr. Isha, your voice is really breaking.
Pad or a sanitary pad is usually just a
Is it just breaking for me?
1
No,
second.
it's
It is a little
breaking for
choppy.
her.
It's a little choppy.
Is it better now? It's a little
Yeah.
choppy. Okay. 1 second. Let me try switching off the fan. Is it better now?
Yeah, it is. Yeah.
Okay. Okay, great. So yeah, so a pad is basically your sanitary pad, which is either
We can't hear you at all. We can't hear you at all.
or any kind of okay.
We couldn't hear you at all.
Is it better now?
Yeah.
Okay. Yeah, so a pad is basically like a pad of cloth that
Right.
is sterile. That's why it comes in those packs, and it's made of absorbent material, which would not stain your clothes compared to like a regular cloth. So that's the difference. It's cleaner, it's absorbent, all of that. So I'm sure you don't use one, but I would not recommend using a
Your
cloth,
voice broke
like
up.
the homemade makeshift. Sorry.
Your voice just broke up at the end. Yeah, it's fine
Okay.
now.
It's fine. Okay. Yeah. A tampon is basically like this cylindrical small wad of again sterile absorbent material that you put in your vaginal canal. So basically, this is your outside, which is this is your vulva. This is the vaginal canal. That's your cervix, okay, which is the mouth of the uterus. And then this would be your uterus. Okay, so your tampon is this basically, it's like this little cylindrical thing that goes in your vaginal canal and sits there. Okay, so
Yeah.
fine. So yeah, basically that's what a tampon is. The best parts about a tampon is that you can use it while going for a swim, things like that without having to not swim on your period, things like that. It's absolutely safe. Also if you're wearing pants or something that you can see the lining of your pad from, you will not be able to see that at all at a tampon. So again, very safe, very good. The only like complication or not great thing is that you have to be very careful about changing it in 12 hours or so. If you keep it for more than 48 hours, if you keep it in and forget about it, you do have a higher chance of infections because it's a foreign body that's inside you. So, but otherwise, I highly doubt a lot of people would forget about it. So, again, one thing you should keep in mind is to change it every 12 hours or so at the maximum.
Yeah.
So that's a tampon. A menstrual cup is actually really cool because it's environmentally friendly. It's reusable.
Right.
It's this little silicone cup kind of thing that sits in your vaginal canal and kind of stores the blood that comes out. Very honestly, we think that there's a lot of blood that comes when you're on your period, but actually, like in reality, the total amount of blood that you lose in an entire period, so how many ever days you're bleeding, is up to 40 ml. That's it.
Right.
It's really not as much as we think it is.
It's like a
So
million.
the menstrual, yeah. So the menstrual cup basically helps, you keep it in for the day, then you take it out again. You can wash it and put it back in. Again, it's very easy to wash. It's just soap and water, and you can put it back in. You can store it in any kind of container. You have it on you at all times, and very honestly, pads and tampons are extremely expensive if you think about it on a regular basis. And we use maybe a pack of pads, every period.
Yeah.
It's it's quite expensive when you think about it. So in that sense, menstrual cups are like a really good, environmentally friendly, cost friendly alternative. So that's basically the three main things that you would use on your period.
Is it always the case that you need to get your period once a month? Like most of us have a very irregular period, especially at this age between 18 to 21. And some take hormonal pills to control them and reduce the discomfort. Is that safe?
So basically, your period to be qualified as a regular period should be lasting anything between 3 to 7 days and
Yeah.
coming every 21 to 35 days. So, for example, if you get your period on the first, it's okay if it's like 3, 4, 5 days up and down, or sometimes it's like you'll get your first period on the first, and then your next one is on the fourth, and the next one is on the eighth. That's still a regular period. That's a 32-day cycle. So it's absolutely still regular. Again, 1, 2, 3 days up and down is fine. However, when you've missed a period, missed many periods, you get them once in 6 months, once in 3 months, or maybe even not at all. That's when you should at least worry, because we have to figure out what is wrong. That's not normal. It may not be a cause for concern, but it should be checked out. So there are a lot of things that can cause irregular periods. So apart from, of course, the highly publicized PCOS, we also have thyroid issues that cause irregular periods. Your normal stress, change in environment, gain or loss of weight, sudden change in your diet, change in your exercise habits, um, if you've developed any eating disorders, all of that affects your period.
Okay.
So again, so a lot of y'all may have moved from, your hometowns here. There's a lot of stress, there's a lot of change, there's a lot of upheaval in your life. That again could be a cause. But if, this subsides, which is in a month or so, you kind of find your footing, you learn to manage your stress, your diet, and all of that kind of goes back to some kind of a cycle,
Yeah.
that's when it should normalize out. If
Right.
it's been more than 3 months that you've not gotten a period, you should get it checked out just to see what's wrong.
Yeah.
Um, I think that's very important. Also, if you've been sexually active and you miss your period, please do a pregnancy test. Pregnancies are far more common than you think they are. And, you would rather diagnose it earlier than later, because earlier there are a lot of more things that we can do for you compared to later.
Yeah.
So, so I think that's very important. You should be kind of, in that sense, at least tracking your cycle in a way just to know that is it coming every month.
Yeah. And what
So
about the hormone
that's
pills that people take to like get their periods on track and like are they?
so yeah, so these hormonal pills are basically prescribed medications. So it's not usually taken by just anyone. They'll be prescribed by your gynecologist. There are two instances usually that we give these pills. One is that if you need it for contraception, it's one
Yeah.
of the best methods for contraception if you are having regular sex with one partner. So that's it's I like one of the ideal methods of contraception, because the side effect profile is not as high now, and there are far better newer pills with very very minimal amounts of hormones in them. So that's one of the indications. Another one is if your period is, you've been diagnosed with, say, PCOS, and your period has not come at all, or you have, you don't get your period every, not even every month, like you just don't get one, or you get it every 3 months, every 6 months, things like that. When it comes to like these less than three periods a year, you may have a chance of developing endometrial hyperplasia, which is basically an overgrowth of your uterine lining. Like we said, during your periods, your lining sheds every month, right? So if it doesn't shed, it just accumulates, and then the next lining forms on that, and the next lining forms on that. Also, if you have some kind of hormonal imbalance, it's showing up in, other symptoms. You have PCOS with, say, a lot of things like hirsutism, severe acne,
Right.
all of those issues, then we would prescribe you these pills. However, it's, at least personally, I don't prescribe them to every single person with irregular periods.
Right.
Um, because at the end of the day, also, if you are diagnosed with PCOS and you're at that point obese or not really haven't gotten into your lifestyle modifications yet,
Yeah.
and you don't have to be obese for that. Like, the management of PCOS is to manage your lifestyle, but
Right.
managing lifestyle takes at least 3 months at the minimum.
Mhm.
So, what do you do for those 3 months as a support? Then for those 3 months, you can give the pills as an adjunct. But
Right.
again, those would be short term, very low, very less. Gynacs actually give it for a very long term effect, unless it's for contraception. Then it can be used for even up to 5 years at one go.
So, what can we do to reduce the pain and discomfort that comes with getting your period? Especially like if one has an irregular cycle, there's a lot of cramps and headaches and backache. And
Yeah, yeah.
yeah, so how
Oh,
can
of
like what are some
course.
nice ways you can get rid of that?
So that's part of basically the PMS complex, and complex isn't because it's a multitude of symptoms. That's why it's called a complex. But I think the statistics say that 3 out of 4 women at some point have experienced PMS in some form or another, which
Yeah.
is incredibly high. And yeah, so I think there are a lot of things that you can do. Again, this is because of the fluctuation of your hormones going up and down at that time, because your hormones are trying to balance out themselves as
Yeah.
part of the cycle. So sometimes these rapid fluctuations cause all of these symptoms. In some people more than others, but yeah, so that again, if you have cramps, one of the things that really helps is a hot water bottle or any kind of heat. And I'm sure every girl is like, who's had this, is nodding, because yeah, it really helps. Heat is a very good painkiller. Also, drinking something hot, putting something hot on you, all of that is, really good. Ginger is shown to be good for pain. Ginger is also good for bloating and, the GI issues. Sometimes some people have diarrhea, some people have constipation, some people have just bloating, water retention, all of that. Again, following, these very simple things. One is drinking a lot of water. So at least 2 liters of water a day, especially during your period, or even 2, 3 days before and after. Following a healthy diet in that sense. So, like, staying away from processed foods, staying away from very high carbs,
You know,
staying away from spicy, oily. Sorry.
there are these cravings that makes you crave all the sweets and processed food, but like it's advisable to stay
Yeah.
there.
Oh, yeah, please. Like, stay away from them, especially if you do have these PMS symptoms. Even salt. So, like, you're craving for chips and desserts would unfortunately make all of your symptoms worse.
Right.
If you have no symptoms, that's fine. That's really good for you. But again, this is something that, we should follow, which is lowering our salt intake and lowering our sugar intake as well.
Yeah.
So I think that's usually about it. And also, I think it's very important to say this: there is no harm in taking the over-the-counter painkillers
Yeah.
if you're in pain. There's nothing wrong with them. They're absolutely safe. We give them in pregnancy as well. So,
Oh,
they're absolutely safe. There are enough studies done about them. They're also over the counter. That means they're not like such high doses that they're going to do anything very major to you. And it also doesn't make you weak in any way that, I have to take a tablet and things like that. So if you're in pain, please take that antispasmodic, which is anything like you can take a cyclopam, a meftal spaz, a
Right.
Drotin, any over the counter antispasmodic that's available, that's totally fine.
Right.
However, if your pain doesn't subside even after taking those pills, then I think you should get yourself checked out by a gynac, because it may be an underlying condition or something like that.
Right. And there have been a lot of myths associated with periods. Some being that, like you pointed out earlier, that women should not wash their hair while they're on their periods and stay away from spicy food like pickles. Could you shed some light on these?
Yeah, oh my God. These myths are there everywhere.
Yep.
Especially in India, about a lot of, everything that women do is kind of shrouded in these myths so that, I don't know why, but it's absolutely ridiculous. Some of them don't even make sense, but
Exactly.
I think most of them don't make sense, because if you ask the simple question of why, then there's no answer for that. They just say, no, no, it's been said like this and
Nonsense,
things
yeah.
like that. Yeah. So there's no kind of reality to the fact that you shouldn't wash your hair, you shouldn't have a bath, you shouldn't go out in public, can't go to the kitchen, you can't, like, even like temples, I think,
Yeah.
like there's no scientific basis to any of that.
Right.
Now, I'm not going to tell you what to follow in your
Yeah.
family or your life, but there is nothing scientific that kind of stops you from doing any of these things.
Right.
So, even don't eat some papaya. Like, there's nothing like you can eat. I don't know. There's no amount of papaya that you can physically eat that is going to really change anything.
Right.
Um, yeah, what else have I heard? Yeah, the don't eat anything spicy
Yeah.
just comes from the fact, I mean, that kind of is scientifically fine, because spicy, oily foods do increase your, GI symptoms, which is all your PMS symptoms, like your bloating, constipation, diarrhea, all of that. So it could
You have
make
to
it
stay away from
worse.
spicy food.
Yeah, at least if you're experiencing any of those things. If you don't have any issues during your period, then there's no harm in eating spicy food. um so that's, I think, absolutely fine, but that's maybe something that has at least some kind of backing to it. Yeah, but like don't eat sour food. Like, I think honestly sour food like lemons
It
contain a
helps.
lot of vitamin C, and vitamin C is very good for you, especially like during your period. You do have a higher chance of falling sick because of your immunity reduces a little bit during that time. So again, vitamin C is good for you, so there's no harm in anything sour in that sense. Otherwise, I think, yeah, if anyone has any other myths or things they'd like to clear out, please ask, and we
Please
can
put
we
the
can
chat
clear them out.
that at the end. And are there any things that a woman should actually avoid when she's on a period, like physical exercise or something?
You know what? There really isn't. Just don't like, there's nothing that you can't do any other day that you can't do on your period. The only thing is, one thing that you shouldn't do anyway is douching, which is when you think that you're on your period, it's dirty, so you're going to put like your shower head up, or try to clean it by putting water inside your vagina, things like that. Don't do that, and especially not during your periods. But yeah, otherwise there is nothing that you can't do on your periods. Like, now you can even swim if you wear a tampon. People have won Olympic medals while they've been on their period,
Yeah,
things like that. So I don't think there's anything that a period can stop you from doing, or should stop you from doing.
exactly. So yeah,
Question, ma'am, is as a guy who's seen his mother, sister, and female friends go through their periods, what can we males do to support women who are in this menstrual phase?
First of all, one of the things I was really happy about when, you guys approached me for this lecture was that it wasn't just for girls, or just wasn't just for women. It wasn't like a separate lecture, like, in school where the girls go and have one
Yes,
class
only for
and
the
the
girls,
boys
right?
go and have another class. And, it really wasn't like that. I think something that we have to normalize for ourselves and, of course, for the future generations is to just normalize talking about this, because
Absolutely,
it's
ma'am.
just a part of health, like it's a part of your life. There's nothing dirty or weird or like, how can we talk about this in that
Right.
sense. So I think if we just make it a normal thing, hopefully someday it'll be great. But I think that's great. So at least, the fact that we are having this conversation with more than 180 of you, and I'm sure at least 50% of you are, men. And, just talking about this, listening to this, okay, I'm sure half of you are laughing, and that's fine. But at least you're listening. At least, you're a part of the conversation. So,
Definitely,
yes, I
ma'am. We really
think,
hope that all this
that's.
points towards that direction where one day we can just talk about it very freely among each other.
Yeah, and like I don't think there's anything wrong about it, because now I think a lot of girls also are not super weirded out about it. So it's like, oh, I don't want to do this, no, I have pain, I'm on my period. And that's just what it is. It's not like a big deal anymore, or it shouldn't be a big deal anymore. So I think one thing that everybody can do is just make it a normal thing and not make it like this bigger thing than what it is. um yeah, of course, trying to understand that, like, just because you're on your period doesn't mean you're PMSing, or just because you might be PMSing doesn't mean you can't make valid decisions. I
Right.
think a lot of pop culture and a lot of TV shows and memes and whatever kind of ridicules this a lot. And it's fine to just make fun of it, but it's not fine to think that that's reality and actually treat people that way. So I think a lot of these small things, but even really small things like just getting pads, or if there's a girl and you see a stain, like a blood stain, just kind of tell them,
Right, right.
take them on the side and be like, there's a blood stain. That's it. Like, just be normal about it. And yeah, I think that's about it. I don't know what else. Does anyone else have any suggestions for what guys can do?
Yes, ma'am. I mean, we as guys will try our best to be as supportive as we can. So yeah, now coming to the next question, ma'am. So now that we have more clarity on what periods are all about, it is said that if a girl is on her period, she can't get pregnant. Is that true, or is that just a myth?
Okay, so when you look at the menstrual cycle, or even when you study the menstrual cycle, you can ovulate, like you can get pregnant only when you ovulate, which is when the egg,
Right.
comes out of the ovary and goes towards the uterus. That's the optimum time of ovulation. But sometimes, I think, again, not the most common, but sometimes you can have irregular periods. You could have just not have a lot of bleeding. It could be just a spotting in the middle of your period, and you may not realize that it's the middle of your period. Sometimes your
Right.
periods can go up and down. Sometimes your ovulation can go up and down. So if you do look at it like on paper, like, no, you really shouldn't be able to get pregnant on your period, because the lining isn't thick, there's no egg there, all of that. But it does happen, because like, unfortunately, our body is not a machine. It's
Right,
not
right.
like part A will do something and part B will do something else. And at time 2:05 this will happen, and 2:10 that will happen. And that's unfortunately not how our body works. So there have been cases of pregnancy, and these are all documented cases of pregnancy when they've had sex on their period, unprotected sex on their period. So I think I would stay away from that. Also, I mean, you can get an STD whenever,
Right,
on
right.
your period or not.
Staying
And
safe is very
again,
important.
STDs, yeah, and STDs again are really not talked about much. And in India, we assume that that we don't have them, nobody has them. It's just a US thing,
Right.
that you see in movies or in colleges in the US. Like, this is
Right.
India, we don't have STDs. But that's very, very untrue. Even in my own practice, I have treated a lot of STDs. Even data says we still do have a lot of STDs. So I would really be careful.
Right, ma'am. That is very well understood. Coming to the next question, ma'am, of protected sex, what are the safe contraceptive measures that people can take to avoid pregnancy?
Um, Use contraception. Like, always use contraception. I think now the best thing to do is looking at, different contraceptive methods are useful for different couples and different needs. So, for example, if you're having casual sex with different people, you would be ideally suited for a particular method. Example, condoms. If you are having sex with one single person very regularly, but just that one person, then maybe like the birth control pill or the NuvaRing, things like that would be ideal. So honestly, it depends on the couple, but I
Right.
think it's
Mhm.
very important to use contraception because one, chances of pregnancy are very high.
I. Mhm.
And it is really scary to, first of all, even have a pregnancy scare. It's very scary. um, and the second is to even go through an abortion. And one of the criteria of getting an abortion is that you have to have a reason for getting an abortion. So a lot of
Right.
people would not know this, but if you want to get an abortion, medical or surgical, it has to fit in some kind of criteria. So, for
Right,
example,
ma'am.
if you have gotten, pregnant as part of a couple after voluntary, sex, and you have not used any kind of contraception, you do not fall under the criteria to get an abortion.
Right. Awesome. That's big trouble
So,
then.
yeah, which is then what do you do?
Right.
So,
Mhm.
and this is again a very legal process. It's not something that gynacs can control. It's if you don't fall under the criteria, you can't, like, I can't do it for you. It's illegal. Then I would lose my license. So
Mhm.
so things like that. So apart from just STDs, apart from just the pregnancy risk, even like this is a risk. So I think it's very important to use contraception at every time, even including, so even like your pre-ejaculate has sperms in it, even
Right.
though you may not have like ejaculated and things like that. That doesn't mean that you still can't get pregnant. And again, these are all researched and published research studies that have proven this. So these
Right,
are
ma'am.
not myths, like these are actual, this is reality.
Right, ma'am. So you mentioned that condoms were not only a reliable source of method of contraception, but they also help prevent the spread of STDs. So for everyone here, ma'am, could you elaborate what these STDs are and their symptoms just in brief?
Yeah, sure. So first of all, I think condoms are great, especially for college life and things like that, especially when you may not know the sexual history of your partner. A lot of STDs are not um like symptomatic, if you know what I mean. Like, you would not have any symptoms, or you may not have any, like, it's not like you'll be sick and giving it to somebody. It may be dormant inside, and especially in most men, it is usually dormant. So you may have, for example, chlamydia, and that is dormant in a guy, but when you have sex, it goes to the girl, and that's when it kind of becomes a full blown infection. So I think now the most common STD is your herpes, which is either genital or oral, can be passed both ways. And that shows up as these little red papules, like these little red bumps, either on your lips or in your genital area. You may have some fever, you may have like a rash, it may be red, itchy, all of that. Then we have, chlamydia, gonorrhea, syphilis, which again show up as vaginal or penile discharge, which is like yellowish color, like pus. You may have a lot of white discharge. It may be a lot of itching. You may get UTI symptoms. Again, this is for both men and women, but usually it shows up more in women. But that doesn't mean that the guy shouldn't be treated as well, because it can cause long-term problems as well in both sexes. So I think that fever, UTI symptoms, discharge, a lot of discharge, especially if it's yellow in color or smells bad, things like that, and especially after, your sexual experience or whatever, even if it shows up a week or two after, and any kind of rash in that area is something that you should get checked out.
Yeah. So, ma'am, apart from using condoms during sexual acts, what other things can be done to prevent an STD? Is there anything else?
Um, so one second. Yeah, sorry, can you repeat that question again?
Yeah, ma'am. I was saying, apart from using condoms during sexual acts, what else can be done to prevent getting STDs? Other methods
Okay,
of contraception.
so unfortunately, the pill or an implant or any kind of hormonal contraception would
Mm-hmm.
not prevent you from getting an STD. So you would need some form of barrier contraception. So it could be a male condom, it could be a female condom.
Mm-hmm.
If you're attempting oral sex, it could be a dental dam. But the ideal, like the easiest one and the most available one and the safest one out of all of them is the regular male condoms. So I think that is the most ideal method to prevent STDs.
Understood, ma'am. So finally, ma'am, how exactly can STDs be cured? Can they be cured?
Okay, so depends on what kind of STD it is. Herpes, unfortunately, you'll always have it in your system, and it can flare up at any time. So that is, like, unfortunate. If you get it, you get it. But the outbreaks we can manage with medications and antiviral therapy. Syphilis is very easily cured. So is gonorrhea. So is chlamydia. All of those three are again easily cured. HIV, the big the big word, is cannot of course be cured, but it can be managed really well. And recently we've had a lot of success with the antiretroviral therapies. There's
Mm-hmm.
another STD which is again commoner than you think it is, which is hepatitis B. So this can be spread through blood or any other, like your sperm and vaginal fluid, things like that, but also blood. So even needle pricks and blood transfusion, things like that, can cause hepatitis B, which again cannot be cured, and a lot of times lies dormant. But the most common ones, which are which usually cause these infections, which are overtly seen, those can be cured. So but they don't go away by themselves. They need antibiotics or antivirals. So please don't like just sit on it, because these infections can, like, especially for women, um go inside, like through your cervix, can go inside your pelvis and inside your abdominal cavity and cause a lot of issues, from adhesions to severe pain to pelvic inflammatory disease to even infertility. So like, if you do have any of these symptoms at any time, please see your gynac ASAP, because it is very easily treatable. Second of all, your gynac will not tell anybody. I think a lot of people, especially younger people like your age, have this scare that my doctor will tell my parents, or
Mm-hmm.
will tell my relatives, or will tell somebody, or will make me come with a relative or a parent. However, that is absolutely not true. You are first of all protected by doctor patient confidentiality, which is very much still a thing in India. So it's against the law for me as your doctor to divulge any kind of personal information to anybody. If you are not a minor, so that means if you're above the age of 18 or above, you can go to any doctor by yourself without needing a parent or a guardian or a sibling or anybody with you. You can go and you can get treated, and you can get a consultation, all of that, and it will be completely confidential and private to you. That's it. So I think that's something that's very important. So please don't let that scare you into not seeing a doctor.
Right, ma'am. That was well understood. Yeah, so with that, ma'am, I have exhausted my questions, but I'm sure the others have some. So let's have an open Q&A session where anybody else can ask their queries over here. So if there's anybody who has any questions, please come ahead and be free to ask your query.
Yeah, and you can keep it anonymous or whatever. Don't read out the names, just ask
Uh,
questions.
Ma'am, there is a
So,
question in the comment box. I'll read it out for you. So,
sure.
what should we keep in mind about daily hygiene in context with STDs and STIs?
I think if you notice any change in what's normally happening, so for example, suddenly you see a lot of discharge, suddenly you see a rash, suddenly you see, something different like a bump or whatever, or, you're itching down there for some reason, like suddenly, that's something you should worry about. Again, your normal cleanliness is very important. Even like apart from girls, which is keep, change your underwear, wear cotton underwear, preferably a little looser one. Change every 12 hours your underwear or whenever it gets completely soaked. Wash inside outside with water, that's it. But wash at least once a day. That is again for women. For the guys, it's, I think, very important to have hygiene in your genital areas as well. So please wash your penis after going to like peeing, things like that. Clean your foreskin as well. That's a lot of times which we do see a lot of infections in, which are not STDs but which are just general because of hygiene. Please change your underwear or your boxers regularly. Do not stay in the same ones. Especially after you work out, it is advisable to have a shower, so that you keep your groin area clean. So I think it may sound stupid, but it's just the simple things. It's not something elaborate. It's just like the basic hygiene things. If you manage that, you shouldn't have any infections down there, and you should be able to see then, in cases of an STD or something like that. But I would really recommend using condoms. And if at all you want to stop using condoms and switch over to hormonal birth control, you should both do like a basic STD test at least. They are unfortunately very expensive in India, so it's quite difficult to run a full panel, but at least the basic ones are important to check.
Right, ma'am. So, going into that, so somebody asks side effects of oral contraceptives and their effectiveness. Could you elaborate on that? So, do these
Yeah,
oral
sure.
contraceptives? Yeah, please go ahead, ma'am.
So, oral contraceptive, which means your birth control pill, is not your eye pill. Okay, so I want to kind of just clear this out. This is a pill that you take every day or almost every day. Um, so, again, the effectiveness, if taken properly, if taken every day without missing one, is effective if taken properly. However, if it's not taken properly, you have a higher chance of getting pregnant because, once you stop those hormones, you would, suddenly ovulate, or you do have a chance where you might have an issue with that. So, if taken if taken properly, if taken on time, if taken every day, it is one of the safest and the best methods of contraception. So that, what are the side effects?
So the latest tablets that we get are very, very low doses of hormones. They're the same amount of hormones that your body makes. That's about it. So and they're very well regulated. So again, a lot of the times side effects are barely any. um, some people may have a little bit of bloating. Very rare cases you would have hair loss, or even a higher chance of depression in very rare cases. But if you do start having any of those symptoms, we switch out your pills immediately, and we put you on something else, or we stop it completely. The one thing is that you cannot smoke while taking these pills. That's very, very important to talk about. So please ensure, if you're taking them, don't smoke. A lot of the newer pills also actually help with the bloating. So they reduce bloating in some cases. So the spironolactone ones are pretty good in that sense. So nothing like weight gain. They also help with acne, so it'll reduce your acne. Um, yeah, I think that's about it. The two big side effects that we worry about are hair loss and depression or mental
Ma-
health concerns.
right. We have another similar question, ma'am. In the long run, is oral pill better than implant, or is it vice versa?
It's very similar. Um, it's just that, I mean, an implant is great because you don't have to take it every day. You just put it in and completely forget about it till you have to kind of, get it out again. However, one thing is that you may have a little bit of irregular periods. While on the pill, you will have absolutely regular periods. And also, it's easier to get an implant. Not every gynac may have it available on them, so you may have to hunt a bit for someone who has it. But otherwise, it's similar. It's hormonal contraception. That's not an issue. One thing I'd also like to say is, with any hormonal contraception, these are all reversible forms of contraception. So that means you will not lose any fertility long term. You will go back, like once you stop taking it, you will go back to the fertility you had before,
Mhm.
um, within 3 months. But
Right,
that's
ma'am.
the fertility you had before. Like if you already had infertility issues and things like that, it's not going to make it better. So I think that's something that we should keep in mind.
Right. Now, next we have a question that a lot of guys are curious about. So there are many female gynecologists available, but what about males who face trouble with sexual health? Who do they approach?
um I mean, why wouldn't you go to a female gynecologist? We do sexual health as well. I do sexual health. I counsel men as well on sexual health. However, if it is an impotency issue, or something like that, again, at least to diagnose it, your gynecologist, male or female, can diagnose that, or at least help you out with that. If there is an issue, for example, impotency, then a urologist is who you are referred to. So, a urologist is basically a specialized surgeon for your kidneys, your bladder, your penis, all of that. So they do that. But again, a lot of urologists may not do sexual health, but your gynecologist definitely will do sexual health. So please don't be kind of apprehensive because it's a female. But I think gynecologists that are trained in sexual health care would be the best bet for you.
Right, ma'am. So the next question: is it abnormal to not have any sexual inclination?
No, so again, this sexuality is now on like this spectrum where they talk about the fact that you may be asexual, you may be demisexual, you may be pansexual. It's this huge spectrum. And I think if you read about it a little more, if that's something that you feel that you want to read about, You really should. There is nothing wrong with not having any sexual desire at all. That doesn't make you abnormal in any way. It's an absolutely normal sexual orientation. um yeah, so no, not at all. It's normal. But if you have had um sexual desire for any of the sexes or whatever, and you suddenly lose it, then that may be something to worry about, because that may be something medical.
Right, ma'am. Yeah, got that. So with that, ma'am, I think we're done with the Q&A session as well. I think we'll wrap up with the session since we're due to time constraints. And yeah, thank you for coming. We really found it insightful, and I'm sure all of us have learned something new. I personally, I felt this was the best session that NSS IIT Patna has experienced. It was a pleasure having you, ma'am.
I'm so glad. I hope it helped at least one out of the 185 of you.
Definitely, it surely did, ma'am. I can tell you that.
Okay, great.
Right, so I think
Thank
we've
you
come
so
to
much
an
for
end.
coming.
I'm so glad we did this. So yeah, that was great. If you guys have any other questions or anything else, I do post a lot about sexual health and menstrual health on my Instagram, which is Premaa Health. So if you want, you can just check that out if you have any other doubts or whatever.
Yeah, we will certainly do that. And thank you so much for coming. It was great having you.